Let's talk about the extraocular muscles from the anterior approach. Before we arrive at the extraocular muscles, we're first going to encounter Orbicularis Oculi. Orbicularis Oculi gets its name from the circular fibers of its muscle, so that's the orbicularis part, and oculi because it's surrounding the eye. Now there are three parts of Orbicularis Oculi muscle, two of which are visible here. There's the orbital part. This orbital part is surrounding the orbit, and when activated, the orbital part clenches the eye closed, so it makes the palpebral fissure clenched tightly. There's also the palpebral part of Orbicularis Oculi. The palpebral part of Orbicularis Oculi covers the palpebrae, or the eyelids, and when activated, these wink or blink the eye. There's also a lacrimal part, deep, that we can't see, that when these fibers are activated, they squeeze the lacrimal sac so as to draw tears towards the medial canthus of the eye. Now, Orbicularis Oculi muscle is innervated by motor branches of the facial nerve, specifically by zygomatic and sometimes temporal branches of the facial nerve. As we move deep to Orbicularis Oculi, we begin to encounter our extraocular muscles. And the first one is a bit of an oddball. Most of the belly of this muscle you'll see from the superior view of the orbit. This is Levator Palpebrae superioris muscle. Levator Palpebrae superioris muscle is responsible for the elevation of the upper eyelid. It attaches from the apex of the orbit to the tarsofascial layer of the superior palpebrae, and it's innervated by the superior division of the oculomotor nerve. So that's cranial nerve 3. As we move through the tarsal plates and clean out the orbit, we begin to see the extraocular muscles take shape. So let's orient ourselves here. This is medial, this is lateral, this is superior, and this is inferior. So the rectus muscles are likely the most obvious muscles that we can see here. So let me just outline them for us. So here's the superior rectus. So superior rectus. Here's the inferior rectus. I bet you're detecting a trend. A lateral rectus and a medial rectus. And these are accompanied by the oblique muscles, the inferior oblique, which we can see here, is a little more obvious in this photo. So that'd be inferior oblique. And then again, the belly is going to be a little more prominent from a superior view of the orbit, but we can also see the tendon of the superior oblique muscle there. Now, how can we tell? Let me erase all of this and take these one by one. So let's start with the superior oblique muscle. I can see a little bit of its belly running through here, and its tendon runs through a little hook here known as the trochlea. So that serves as a pulley for this muscle. So it's coming from the apex of the orbit, just superior to superior rectus muscle, this way, through this trochlea, and then the tendon wraps around, and it's going to insert on the sclera of the posterior superior eye. It's innervated by the trochlear nerve, so cranial nerve 4, and I always remember that because the trochlea is associated with this muscle. So cranial nerve 4, the trochlear nerve. And when active, this muscle is going to have several actions upon the eye. Clinically, its most significant action is going to be for intorsion, or the rotation of the eye in the direction that the arrow is indicated. And it also abducts and depresses the eye. So abduction and depression, so it's turning the eye downward and outward. And you can see how those actions are very congruent with intorsion. So that's the superior oblique muscle. Next we have the superior rectus muscle. The superior rectus muscle attaches from the common annular tendon at the posterior portion of the orbit to the sclera of the superior eye. Superior rectus is innervated by oculomotor nerve, that's cranial nerve 3, specifically its superior division. And when superior rectus is activated, that's going to adduct and elevate the eye. So elevation is probably one of the more obvious functions, but it also serves to adduct, or move the gaze towards the midline, recalling this is medial here. And superior rectus, like superior oblique, is another muscle that serves intorsion. So I always remember that the superior muscles, both oblique and rectus, are responsible for intorsion of the eye. So moving right along from the superior rectus, we have the inferior rectus muscle. Like the superior rectus muscle, it attaches to the common annular tendon, and it attaches that to the sclera of the inferior portion of the eye. It's innervated by the inferior division of cranial nerve 3, so much like superior rectus, but a different division. And when activated, inferior rectus muscle is going to be responsible for adduction. So that's turning the eye inward, and depression of the eye. Depression is probably the more obvious function, owing to how that muscle is situated. So adduction and depression of the eye, drawing the gaze inward toward the midline and downward. Inferior rectus is also a slight extorter of the eye as well. Next up, we have medial rectus muscle. Medial rectus, as you may guess, attaches from the common annular tendon to the sclera of the medial eye. It's innervated by the inferior division of cranial nerve 3 again. So oculomotor nerve, oculo, eye, motor, moves. The medial rectus. The medial rectus, when activated, is an adductor, adductor of the eye or of the gaze. So that draws the gaze directly toward the midline. One of the more simple movements of the extraocular muscles for you to remember. Then we have, let's just call this lateral rectus muscle. So let me outline this for you here. This is the lateral rectus, and it is just adjacent to the lacrimal gland. You can see the lacrimal gland sitting in the lacrimal fossa, just superior and lateral to the lateral rectus muscle. The lateral rectus muscle originates from the common annular tendon, and it attaches to the sclera of the lateral portion of the eye. The lateral rectus muscle is innervated by its very own cranial nerve 6, the abducens. And the abducens is going to give you a giant hint as to what the lateral rectus muscle does, and that is to abduct, abducens, the gaze or the eye. And then finally, we have the inferior oblique muscle. So the inferior oblique muscle originates on the floor of the orbit, so the orbital part of the maxilla, and it inserts on the sclera of the inferior eye there. The inferior oblique muscle serves several functions. It is an abductor and an elevator of gaze, so it's turning the eye upwards and outwards. It's also an extortor of the eye as well. The inferior oblique muscle is innervated by our good friend cranial nerve 3, the oculomotor nerve, specifically the inferior division. Moving right along, if we were to enucleate the eye, we can still see the extraocular muscles here. So we can see here we've got Levator Palpebrae superioris. We have Superior Rectus. We have Inferior Rectus, Lateral Rectus, Medial Rectus, the tendon for Superior Oblique, and we can see the belly of that muscle there, as well as Inferior Oblique. And as we move deeper in the orbit, we're not yet at the common annular tendon, but we can see how the rectus muscles, superior, inferior, lateral, and medial, are able to take their origins from that common annular tendon. Thank you.